anyone go to visit doctors with your patients? Anyone ever done that? If you have a complex, I don't do it all the time. I really pick and choose when I go, and it just depends on where you work, right? It just depends on where you work. But what a great, amazing opportunity to build your reputation, your own brand, right? It doesn't matter. You don't have to go out on your own. You can work for somebody for a super long time. You can decide to go on your own, whichever one it is. It's just a really great opportunity to, I think, build relationships. I've always been able to do that. When I started I started in acute care, and I would see the doctors on the floors, and I would always just make it a point to, like, sometimes you can, like, make sure that you're there at the right time, just to chit chat with them and talk about this case or that case. And when I moved into outpatient, I was given this opportunity as well. So sometimes you just have to take your opportunity. You have to make sure that somebody knows that, hey, this is something that you could do, right? It does take time out of productive patient care. So that's why I say, be thoughtful and pick and choose who you're doing it with. But today I had a chance to go and talk to the surgeon with my patient because she has rheumatoid arthritis. She's young, and she needs surgery. So, and the reason why was she's just like, she's very emotional about it because she's thinking about what she did in the past. She's trying to be present, but she's also thinking way, way, way ahead in her future, like what's my life going to be like, and that kind of stuff. And if you can imagine somebody with rheumatoid arthritis, in this day and age, everyone's looking stuff up, right? They're looking not just at the information and how to eat and how to exercise, but they're looking at the deformities that are coming from from rheumatoid arthritis. And I'll tell you, before I go into the lecture, that, when I was, and this is a hand surgeon that I know, respect, and I actually refer quite a few second opinion cases to, right? So if I have a surgery coming from somewhere else and they're not quite happy with the results or they're looking for a second opinion, he is one of my top choices I always recommend. So if over time, as you build your reputation in the, as a hand therapist, as a specialist, you don't have to be a certified hand therapist to do this, but this is a great way to start building up that reputation of yours. But I was talking to him about rheumatoid, arthritis, and she had a lot of questions, and I was the one who caught the problem because she had gone to a lot of other therapy clinics before finding mine. And I caught the problem, and I was like, yeah, it really benefits you to go to the surgeon and, have a discussion about what kind of surgery you might require, right? And that was the first time that someone had mentioned to her that she might need surgery, right? And that can instantly build trust between you and the patient. When you're able to find these things and you can guide them. And then I was able to give her from the top 2 surgeons that I like who's going to give her the time and attention. When you're talking about second opinion visits, you're thinking about like, oh, who can I send her to that's going to give her the time and attention? I knew this guy would. But you always want to think about the disease process, right? You want to think about the disease process first, and then you think about the biomechanical stuff. And that's going to be, essentially your ortho issues, right? So in terms of RA, what's the disease process? The disease process is that it's an autoimmune, right? What does that mean? That means the body's attacking itself. Where does it attack itself? It attacks itself at the joint level, which is bone and ligaments, right? And it actually doesn't just attack the wrist, it's just that's what we see as hand therapists. It can attack any joint system in the body. It will attack the shoulder, it will attack the elbow, it will attack the wrist. it will attack the knee, it can attack the hip, it can attack the ankles, right? So what happens is, because of the disease process, what you see is a pattern of deformity, right? So the wrist stuff that we see, or the ligament issues that we see, the tendon disruptions that we see, are due to the pattern of deformities. The things that we see it's the deformity, right? We see the pain, we see the decrease in function, we see the decrease in range of motion, right? That's what we see. But we see all of this due to this right here. So she had an inflammatory process. She had an episode because the disease process, and it just attacked her wrist, and she got super inflamed. She actually came to me for her elbow, right? So one elbow got attacked, but it wasn't too bad, but the right one was like the worst one. And then when she came to me, we worked on the elbow, and then I was like, okay, something's going on with your hand, and it started down that path. She was having hand issues, but the elbow was worse. And once the elbow started to resolve, some of the issues about her hand started to really come out. And so what happens is that pattern of that you see usually is a zigzag pattern, right? So like Carolyn, you saying like the fingers go ulnarly, but the fingers go ulnarly because the metacarpals go radially, and it's because the carpal bones go ulnarly. That is that zigzag pattern that you see. So it's really interesting to talk to, just to hear him say those things to her in the way that I was essentially saying. So it allows you sometimes, when you have an opportunity to do that, is to hear how the surgeon speaks, and to make sure that you're essentially still on point with it. And here's the thing, when it comes to clinical testing, everything that we're teaching you in this program, little bit by little bit, you're gaining, right? So I just want you to keep it really, really simple. You're not necessarily, you don't have to go in super detail or anything like that as you're thinking about oh, well, if she can't, open her fingers, take it back to anatomy. What are the problems? So these fingers were starting to drift, but not these fingers. And when you have an ulnar drift, they usually all go, right? And she was having pain. She couldn't lift these two up as much. So if she can't extend, then what's the problem? Just go back to the tissue and say, well, is it her tendons? Can she extend her fingers? The EDC is your MP extensor. So just having her just extend, but she can make a fist, but these tendons here, your extensor tendons have a certain amount of give. Like you can look at your own, right? You see how they move over to the side a little bit? Well, hers was all the way over. And so what happens is it moves too much and it causes a lot of pain. So she couldn't, when she types, she can't just lift them up as easily, right? So that was one problem. So it'd be our autoimmune messes up the ligaments, right? Causes bone to change. So what happens to the bone is it becomes jagged. It can become sharp. It can have spurs. And over time, that tendon passes by and it rubs and rubs and rubs. And then it ruptures. And that's exactly what happened to her. Not only are the ligament, the sagittal bands here, the ligaments that hold that tendon, they're overstretched, right? Because she had an episode and everything ballooned out. And then when all the inflammation went away, it overstretched those tendons. But it had ruptured the tendon to the small finger. So we can see this is the EDC, this is the finger extensor, but your index finger has an extra tendon and your small finger has an extra tendon. And if they can go like this, then you can see what that extra tendon, that extra tendon works. And if you go like this to the small finger, you can see the extra tendon works as well. And I miss that. I could see, I for sure thought it was here, but because I was seeing her open, I totally missed the individual tendon. So this goes to show you, sometimes we're not looking at everything, and it's helpful to go and see, kind of what you miss, right? So it was good. So if you guys have a chance to do that, it's a great experience. And if you put it to, to put to your boss and say, this is an opportunity for me to build relationships with the surgeons that refer to us. It's a win-win. You get the experience as a therapist, but your clinic, your department gets the referrals from the doctor that knows, likes, and trusts you. Hey therapy friends, it's Huang here. Thanks again for watching my video. And if you like videos like this that can help you just crush it in the hand therapy world as an occupational therapist, then hit the subscribe button and enjoy the video. Thanks again for watching.